been introduced on the poster. I'm Professor Muthoni Masai from the Department of Psychiatry. I'm an associate professor and consultant psychiatrist. I have also been doing quite a few other presentations on mental health during these COVID times. But today, I want to make a presentation about a project which we were writing last year. We've been writing it, we've got approvals, and we have started, but would like to really engage the health workers of Kenyatta National Hospital and to join us in this project. So a very brief introduction. I don't have to say very much about COVID-19. We all know that it's been with us now for almost 11 months since the first case was reported. And I think each one of us who is listening today has reason to be grateful. Gratitude is an important thing in mental well-being, that we have survived individually, even as we mourn colleagues and relatives and friends that we have lost. I think I should be on video. Sorry if I, the host has stopped the video, then it's okay. I was just realized I wasn't on video and thought, oh, that's rude. I cannot change that. So the host will put me on video if need be. So we have lost friends, we have lost colleagues, we have lost relatives, and we have been hit hard in the medical profession, even though I'm not very clear about the statistics, but it is not just about statistics, it's about the people that we have lost. And somehow we've come through to 2021, and we have learned to live the so-called new norm, not new norms, but new norm. And sort of with some kind of adjustment to our lifestyles. Even though we have not gone down as a country and as a continent as the world had projected, our healthcare systems and our health workers continue to carry a very heavy load. Now, sorry about that. I was trying to go down, page down, it didn't go down. So let me just use the screen. So recently there was a New York Times headline, nasty one, a continent where the dead are not counted. And they had put this picture from Nigeria saying that all the morgues know about the deaths. Africans, all 54 African countries put together have registered fewer COVID deaths than France. And that doesn't mean people aren't dying from the virus. It's just that we're not counting. That is, of course, not true. And that's what I mentioned there, that the projected devastation to our continent, to our country, was estimated to be very, very high. And we must be grateful that it hasn't come to that. Our health systems have not collapsed. Now, I'm having a problem going down. So that is something to be grateful for. The latest update from the Ministry of Health was a 3rd of January. So I've added another one from the worldometers. So we are counting around 100,000 or 101,000, 102, with about 84,000 recoveries, and the deaths at 1,779, or from the ministry 1,685, which compared to the Western countries remains low. And so although we say we have not been so hard hit, we have still been hard hit economically. and also even in our services, the provisions. If it had been worse than this, I don't know how we would be surviving. So let us look at the positive side, but not forgetting that, again, the health workers are carrying the heaviest load. So, this is why we decided we need to look at this project, we need to work with it. Now, pandemics tend to have a lot of uncertainties, and as of mid last year, we did not know what was going to happen to us. And COVID-19 has been very unpredictable. Every day we wake up to new information, some of it true, good, logical, scientific information, some of it false news, fake information, myths that have flooded the internet and the information system. But healthcare workers wake up every day and continue caring for patients, while some professions have been able to work from home. The frontline workers have to wake up and go, no matter what news they have read that day. And at the same time, we still have our shortages of PPEs or inadequate PPEs, shortages in healthcare personnel. We are hanging in there more or less. And we have had our frustrating scandals of poor pay, not being reimbursed for this, money going where it was not supposed to go. And every morning we wake up. So the levels of frustration and stress are extremely high. And that, of course, includes the fears that you live with. The false information, of course, doesn't help us, and we are currently struggling with information and misinformation on vaccines, and we look forward to a time when the vaccines will come. We hope that the health workers will be the first to be vaccinated, particularly those on the front lines, and that they will accept these vaccines. And I hope that the kind of talk that we are hearing from the lay people, the public, even not just in Kenya, but globally, about digital things being put in your body with the vaccine. I hope that will not deter the health worker community from accepting vaccination, because this is our one chance to be able to be more safer, to be sure about our tomorrows. So currently, you will see a lot of misinformation on vaccines. Go back to your science and think scientifically, and also look for information in websites like the WHO or the CDC websites, and don't be carried away with the thoughts that somebody wants to eliminate Africans, or Bill Gates wants to do this or the other. So this is just for your, the more of that you swallow, the more stressed you get. Now, the reason why we are doing this project, as I say, is this is an unprecedented crisis. This is a kind of crisis in our country that we have not had, and we are lucky because there was Ebola in West Africa. We were very lucky that we have been spared from this kind of crisis before, and the level of psychological stress among healthcare providers who are the frontline soldiers here is extremely high, and it is not equal to the number of specialized providers. If we could each one individually support one frontline provider, that would be the best option, ideal. But we don't have that many psychological support providers. So the project, we are exploring an innovative mental health service, but it is not just for now, but for the future, because even without COVID, health workers have often been left alone with their psychological stress. And also partly because, of course, admitting that you're stressed, you're burning out, you're fatigued, has always had some form of stigma. And we are saying that it is okay to say that you're stressed. It's okay to say, I have fear, I am anxious, and I feel as if I'm going to get burnout. It's okay to say that and to seek help. And we have this opportunity to reach a lot of people through what we call telepsychiatry or telemental health, because at the moment we have our country is very advanced in terms on this kind of digital platform. Nearly every health provider and many more Kenyans have got smartphones. They can be reached on WhatsApp. WhatsApp is sort of like everybody's thing these days, and they can be reached also online like we are doing now. And of course, we have also realized that this is a platform which we did not take advantage of earlier, because we've realized that the attendance to CMEs has increased tremendously since we COVID, because also of the ease and the convenience of this. So what we are trying to look at is how can we offer health providers a service through care through telepsychiatry. And this would set a precedence on how we manage future emergencies. We were not very well prepared. We have done our best, and a lot of people have worked really hard on this. And how can we do that to ensure the psychological well-being of carers? And what we do know so far is that many studies are now reporting very high levels of psychological distress. We suspected this from other pandemics from the West, from Ebola, from SARS, from MERS, but we're now getting a lot of information about very high levels of stress, including very high increased substance and alcohol abuse and even suicide. When we talk about psychological distress, we are talking about frustration, fatigue, exhaustion, feeling burnt out, insomnia, anxiety, depression, sometimes traumatic stress associated with that feeling of trauma that you feel when you feel like your life is threatened, your well-being is threatened, or when you're very close to that, to a stressor, a very traumatic stressor, and even guilt. We have that thing called moral injury. Maybe some of you have experiences. The guilt which you feel like, why did it happen to them and not to me? Particularly when it comes to colleagues, somebody you work with, says, some people have a tendency to wonder, why them and not me? It's not an unusual way of reacting to injury, to trauma. And then you have the moral injury of having, the not being able to meet your obligations as a helper. You are overwhelmed, and then you feel you're coming short. And sometimes you're making decisions, which means you favor this one and not that one. We are at that point where most of the hospitals are now full, so that you find that decisions are made, who is going to be admitted and who not, who gets oxygen, who doesn't. And this does not go without an amount of injury to us as health workers. So we've got fear, anxiety, and depression are the key things that we're looking at. And these are the things that have been found to particularly affect healthcare workers. You have to remember that, and you have, if you're a frontline worker listening, you know that you have a fear not just about your physical well-being. Am I well protected? Am I well sanitized? Am I, am I safe? There have been also the fears of taking the infection home to the people we love, to our families. Some people live with older people and are afraid that you may actually be taking them to vulnerable people or very small children. We have also had fears, people fear carrying when you're moving from one patient to another and trying to think whatever I took from one sick to another one was not sick, and all these things. And we also have to deal with the despair of loss, severe illness, the constant threat of death. This is beyond what we are used to. This is not, it's not that health workers are not used to death and severe illness. And I'm not saying that they should not have been feeling stress even then. It is that they have, some people develop some form of resilience, some just deal with it and end up carrying a very heavy load, like I said, because they think it carries a certain weakness to admit that it's hard on them. So, but this is beyond what we are used to. So these are the things we are thinking about: anxiety, depression, fear, and then compassion fatigue. Compassion fatigue, of course, has been reported increasingly globally, and compassion fatigue is a state of chronic physical and mental distress that you carry from your profession. It is that exhaustion that is that you take from caring for others who are doing badly, who are in bad condition. And it impairs your well-being, but also it impairs your decision and your capacity to provide effective care. So compassion fatigue is one of those things where you say it is important to have an intervention, because if you have compassion, if somebody has compassion fatigue, where they're completely blunted, they're a bit blunted, they're walking around looking like a bit dazed, and almost as if they don't care. And it's not that they don't care, it's they have reached that point, but then they make a lot of decisions which could endanger them and others. And then you have the stigma, which we have been having. It's now less. When, initially people didn't even want to see healthcare workers in the villages traveling to visit, but now that has been reduced. But having COVID-19, even as a survivor, is still, even within among ourselves, still seems to carry stigma, where people have reached a point where they don't even admit that I have I've had COVID-19 or have been sick because of this, because they feel like they're going to be rejected. They're going to be found as if they have failed. Nobody has failed. No health worker has failed by getting infected. It's not something to be ashamed of. And yet we still see this happening. So that is another problem that we have. And these are the three elements of psychological distress that call for immediate psychological intervention. In answering to that question is, who is caring for the caregivers? We have put a lot of things in place. We know that there's telephone lines, emergency telephone lines for psychosocial support, but it is not always that people are taking advantage of this. And it is not like they're enough, but it's also the impression that we're getting even from the call service is that people are not taking advantage of these services. So we want to say, let us take advantage of these services, particularly also when you think about the long-term effect of some of the stressors we're going through. Stress is not just something that psychological stress, an acute one, can be a one-time thing. But in a lot of cases where the traumatic experiences, the thing that is causing the fatigue, is ongoing, it becomes a chronic problem that has the impact of even giving you other non-communicable diseases in the long term. So don't ignore this. Don't ignore your feelings. Don't ignore the services or the help that is being provided. And support for healthcare workers is not just not for now, but it is also for their continued use. And that is what we are saying. We say we need to have systems in place that support healthcare workers who are under stress now and even further on. So the study that we have put in place is called the acceptability and effectiveness of telemedicine-based approach to offering psychosocial support to frontline healthcare workers during the COVID-19 pandemic in Kenya. And we are looking at the acceptability because this is the first time this is kind of thing is being offered in Kenya. So we want to see, is it acceptable? And if it is not acceptable, we want you to tell us what is it we want us to do to make it more acceptable. Because we know that stress is there, it's going to continue being there, and we would like to have systems in place that are able to offer this kind of support, even though the number of specialized mental health providers are low and will continue to be low because these are also global trends. Now, so we want to support our healthcare workers to be strong, to continue living their lives at the individual level, at the family level, community level, professionally, socially, and spiritually. Now and after the COVID, we know that this is affecting the individual, it is affecting families, communities, and even your profession, and even your spiritual life and your social life. We want to strengthen health workers so that they can sustain themselves and so that their families also remain intact, their social lives remain intact, and even their spirituality. And we want them to develop the skills that will make them resilient to future pandemics. Because once you gain the sum of these skills, these are lifelong skills. These are things you take along with you. And we have this poster which we're going to be sending to some of your groups. Maybe you have seen it. We're also going to put up a few posters around Kenyatta, and it just to remind you that your mind matters. Your mind matters, and we're targeting anxiety, fear, grief, depression, compassion, fatigue, and burnout. And we are collaborating, of course, in the first place with Kenyatta National Hospital, and the second main collaborator in this is Kenyatta University Teaching, Research and Referral Hospital. And we also have other partners who we are collaborating with, and I will mention them at the end. And we are trying to include all cadres of frontline health workers. We're not like saying you're this, or you're that. We're saying support should be given to everybody. And some of the specific objective, without going too much into boring you with research details and literature reviews, we do want to establish the levels of depressive symptoms, the levels of anxiety, and like I said, acceptability and effectiveness. We can only do this if we know what levels we're starting with and what levels we have in the midline and somewhere in the end. And we are offering an online group support intervention. We also want to explore qualitatively some of the fears and the coping strategies, because we also know that people are developing their own coping strategies, and we would like to know some of these coping strategies. Of course, not all coping strategies are positive. For example, increasing the amount of alcohol you drink is not a positive coping strategy. Using sleeping or sedatives without prescription is not a positive coping strategies. Now, joining an online prayer group or another spiritual group, or having regular meetings with your chamas, even if you're not meeting physically, you're meeting online in groups or outside in the open spaces, it's a positive coping strategy. So we would like to understand some of the coping strategies that are being explored. Like I said, our study sites are mainly KNH, with, of course, Bagathi, the IDU part, and then Kenyatta University Teaching and Referral Hospital. And we including all cadres of health workers, clinicians, that's doctors, nurses, clinical officers, pharmacists, psychologists, and anybody else who feels left out, laboratory pathologists, radiologists, and technicians, receptionists, accountants, anybody who is a frontline worker or identifies themselves as being directly in contact with COVID-19 patients. Then that also includes our transport ambulance drivers and attendants. And we also included some of the mortuary attendants who are also a group which has been under a lot of stress. Now, we like I said, we're going to do a few assessments. We're going to collect data by telephone. And for this, we have trained research assistants, and everything we are going to do, we'll do on telephone. So don't worry that you may have to attend a meeting or somebody will come to you, and so it is up to you to choose the time that you're free. So this makes it very convenient for everybody. And of course, it also makes it safer for everybody. That includes consenting. And this will be read out to you on the phone and then filled in Google Forms. But as participants, some participants are very digital savvy and like to fill this themselves. They can say, it's okay, I want to participate, but I want to do the fill myself. And then we give you a code to fill. The reason why we need you to have a code is because if you're going to be participating in any of the groups, then we want to know who the code of the person and whether it showed any improvement. We are not collecting, we're not going to be collecting your names in any way, or and the only people who you'll be in touch with are your small group. So we're not violating any confidentiality or anonymity. Now, the intervention, like I said, is online, and we have two forms. We have a few, like 3 to 4 sessions of psychological first aid. And the psychological first aid is for preventing the development or alleviating the psychological distress in the acute stages, the poor mental well-being. It also gives you some skills of managing psychological distress that may have occurred. But our mainstay for this study is the creation of self-care support groups. This is to support the health workers to maintain a healthy lifestyle and social connectedness, which have been found to be very, very important through what we call accountability groups. And I will explain to you what this means in a few minutes. First, psychological first aid, you've all heard about it. It is more or less what we call a low intensity psychosocial support, where they support practical assistance, trying to get people to acknowledge their feelings, how to deal with stress, some of the skills that you can use for this. And this, after the first few sessions of a group, this will be sustained with the self-care groups. Now, what I'm saying is, once you do the assessment and you've done it and we have you, then we will put you in a group. We are also open to people saying, there are a few of us, we are interested and we want to be a group together. Some of our providers who've been working with the different groups which have been ongoing have said that people have different preferences, but they found that also mixed groups, people will meet groups even from other facilities like Kenyatta National Hospital, a few, and from KU, a few. It seems to work very well in terms of support. So you have that options. You can say, I'm going to put together a group and then we do it together, or put me in a group, which is what we've been doing so far. So this group should not exceed 6 people, and preferably 4 to 5. The reason is finding a time when that all people are available, even if it's in the evening or lunchtime, it's very complicated. It means the groups meet once a week and they meet on whatever platform you want. Some people have been meeting on Google Meet, some on Zoom. There are some who also use another platform called Jitsi. So it's up to you to decide with your moderator which format you want. And once you develop that format, you can also develop a small WhatsApp group for just those people where you communicate your timing and you encourage each other through the day. So the meeting is like 45 minutes. It means you need to find 45 minutes, about 45 minutes in a week where you share experiences, where you will have a guide, a moderator who is trained. And we have already trained a lot of psychologists, social workers, and some of our psychiatric registrar, and to moderate the groups. So the question is finding a time, sacrificing 45 minutes of your time to participate in a group to support yourself and others. And let me explain about self-care, because this is very important. You may have read about self-care. WHO defined this as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without support from an outsider or healthcare providers. And this is being the definition. You may know the key things about self-care, and I will mention some of them just now. But the most important difficult thing has been for us individually to sustain self-care. And this is where being part of a group is so important, okay? So self-care promotes a healthy lifestyle on the understanding that a healthy lifestyle is key to prevention of most psychological disorders and also non-communicable diseases. And like I explained a bit earlier, prolonged stress, psychological distress, leads to, predisposes you to getting other non-communicable diseases, including the hypertensions and the diabetes and others. So it is so important for you to have an attitude of self-care. But how do you practice it? You can have that attitude, you want it. How do you practice it? And this is where the group comes in. And this has been very important in COVID-19 because the usual activities and our usual social interactions have become limited. You know that our society has a very strong communality, particularly among women, I must say, not so much among the men. You know, women have their chamas, they meet, they talk, they do this, they do that. Men have been more difficult to get into groups, but they're also catching up. And these are the groups that you need. It is that laughter with your group that helps to alleviate severe distress. There's that communication. We are social beings and we need other human beings. So these have become very limited because we are conscious that we are, as health providers, maybe risking other people's lives. They could also be risking our lives. So it has become, there are limitations, okay? So the risk, like I said, is of NCDs is higher when you have psychiatric disorders like depression and anxiety and fear. Now, self-care, the content I said I would explain, it has three main areas which you need to take. One is a nutritious diet. Nothing new. Some of us maybe in this forum are even nutritionists. We know what a nutritious diet is. The question is not what we know, but what we practice. Physical activity and exercise, and emotional health and connectedness, social connectedness, that capacity to laugh and to feel connected to other human beings. So the idea of knowing about the theory of all these things is we know nothing new. The question is how to do it. And what we're saying is that one of the things we're doing with this intervention is to encourage you to track and chart your self-care habits. Because knowing about self-care is one thing, developing the habits of self-care is difficult. So we are saying you track, you chart, and then you'll be accountable through that tracking, and you will support the members of your group also to be accountable. And I'll explain that. Now, here is the chart that we are using. I don't know whether you're able to see it, whether it's too small, but we will be able to provide everybody with one of these, and then they can print more, or just buy a notebook and write down and say, this is my accountability, this is my self-care group. Sleep, the issues that we need to control are sleep and wake time. Sleep routine, sleep and wake time. You record every week, what is your wake time and your sleep time. And this is one of the most difficult areas for health workers and frontline workers because of the irregular duties. But hopefully these don't vary very much within the week so that you can record wake time and sleep time. We now know that sufficient sleep is very, very important, that having too little sleep or poor sleep even shortens your lifetime, your lifespan, and causes a lot of other non-communicable diseases and mental health disorders. Now, the other one is to stay connected. And here what we are saying, chat, whether you called a friend or called a family member, since we are connected with them in any way, since we are in a situation where we are not doing a lot of that physical contact, call somebody every day, a friend, a family member. The other one is a hobby. A hobby is something that you're enjoying to do, not because it's making you money. So your private practice cannot be a hobby, not because somebody is forcing you to do it, but because you enjoy doing it. Okay, it's some people take up a hobby of. Some people have hobbies, and the question is, do you do something which is a hobby, like one or two every day? Okay, today I read a paragraph, or I read 3 pages. Oops, I moved in a new book I'm reading, which is not for studying. It's not about psychiatry. Maybe it is about conservation of trees, which might be a hobby. Or I'm planting some seeds. I did a little work in the shamba. Those of you who have a little shamba. Or I put new plants in my room. Or I decided to, and I'm putting physical exercise. Some forms of physical exercise are, of course, hobby, but I'm putting them under a separate category. So I hope that you can look for 2 hobbies, if you don't have hobbies, that you can be looking into every day, even if it's 10 minutes of it. 10 minutes. Worry window. This is confuses a lot of people. But positive psychologists, those are psychologists who look at things that people do that are positive, that may improve their well-being, says that some people worry a lot the whole day. It's worried about this and that and the other. And It helps if you have a time of day and even a worry journal where you can say at 4 o'clock, that is not too close to sleep. At 4 o'clock, or maybe at 9 or 6 o'clock when I wake up, I wouldn't want to wake up with my worries, though. I prefer to push them to the end of the day. This is the time when I think about those things that have been worrying me so that I can postponing. It's postponing your worries and then writing them down and then looking at, is this a problem I can solve? Yes. If yes, what can I do? If not, I'm putting it on a postponement box until I find solutions. So put it in a box. So this is a kind of a way to make sure that you don't have underlying worry the whole day. Let's say you're worrying about school fees, for example, your child, they're asking for money, worrying about it. You're doing this, but that keeps coming. So you can tell yourself, okay, this seems to be a worry. So I'm going to deal with it at 4 o'clock during my worry time. I have some people even keep a worry journal. I do that. Then you say, okay, school fees. What options do I have? What are my resources? 1, 2, 3, 4. Okay. Then tomorrow I will start with option 1 because that's the easiest. Take a loan from my circle or family or whatever. So you are, it's a kind of a problem solving practice, but which postpones worry to another time. You may not have a solution. We don't have a solution to everything. You can still postpone. So do you have a worry time? Then the well-being practices, what we call the other well-being practices, include a time for, depending on your religion, for prayer. A lot of us, people are Christians or Muslims, they have their prayer time. Do you have time for that? Or when you just pray, just be there, with your higher being. Some people go for meditation, and it doesn't mean that because you're Christian, you're prayer, or you're Muslim, you can't meditate. Some people do both. And mindfulness has been found to be one of the more easy to learn skills. Mindfulness, moments of mindfulness, when you're just all there, and can also be mixed with other things, whatever you want, the choice is yours. Exercise is very, very important. One of the easiest and cheapest forms of exercise is walking. And even if you don't have a place to walk to, you can walk on the spot. Of course, walking outside is the best thing. But do you have a form of exercise? Others do aerobics on TV, with phone, with whatever. Exercise is absolutely so important. You need to have at least 30 minutes, according to WHO, 30 minutes of exercise every day, active exercise. So look for the one that suits you. You don't have to pay money for it. And I'm not telling you to go to the gym because we don't even know how safe the gyms are, but we're saying find something, 30 minutes of your time. Those with children even combine that, they do it with kids. So gratitude journal is another one which, as we've been practicing with other groups, they find what is this gratitude? For us, for people who are Christian, it is being thankful, counting your blessings. You're brought up with it. It's nothing new. We used to sing it even in kindergarten. Count your blessings, say them one by one by one. A gratitude journal is something that you keep and feel either at the end of the day or early morning to put your mind in a state of not thinking too much about negative things. To be grateful, to be alive these days it's not to be taken for granted. Gratitude, look for 3 things that you're grateful for. And it can be night, it can be in the morning, early hour, as you start your day or as you go to bed. You can add it in your prayer, but you can also put it in writing if you can. The reasons why is that you write it, it becomes more internalized. The problems that we have with thinking is that a lot of times we spend too much time thinking negative thoughts. thinking about the things that are going bad. I'm not telling you not to ignore things or to pretend that things are not going bad. They could be going bad, but there's always something if you look for it. There's always something. Oh, is there a problem? Sorry. Or is it that you can't see?
No, that's sorry. It was just a technical issue on my end.
Okay, thank you. So I was just finishing with that gratitude journal. I don't want to talk too much because the other thing I talked about nutrition. One way to track your nutrition is to make sure that you eat at least one portion of fresh fruits and fresh vegetables. The ones you eat is up to you. But if you eat too many ripe bananas, don't think they are fruits. I think you might end up with a lot of carbohydrates. I love bananas, and you can eat yourself to overweight with bananas. But fresh fruits, fresh vegetables, these have become very, very important, particularly now because also they improve your immunity. The vitamin C's and the whatever. I'm not going to say that I have scientific evidence for it, but I'm saying that eating a healthy diet improves your immunity. But at the same time, it should be one of the self-care. And we are saying, track it. If you look at this form nicely, you see it has Monday to Sunday. You can just put a tick. And don't worry, it is not, doesn't have to be 100%. Drink plenty of fresh water. Drinking plenty of fresh water is not sodas. It is not sugared juices, which are sold. It is water, maji, Avoid sodas because of the sugar content. Avoid the sugared juices. If you're making them yourself, that's okay. And avoid alcohol. I mean, I'm not telling everybody to be a teetotaler or anything, but don't let that be the thing that you take to reduce your stress. Okay, watch that. So you have your ticks here for drinking fresh waters. And then you can do a daily score. And when you meet your group once a week, you can all share, how are you doing on sleep? What is your score, for example, on sleep? Or what is your daily score on Monday? You say, my score on, because it's 1, 1, 1, 1, 1, you can say, my daily score on Monday was 5. But on Tuesday, after I had seen my score on Monday, I decided I was going to up my score by calling friends. That is so easy. Or I decided to up my score by mindfulness and prayer. Or I have now a hobby, so now I'm taking that. So this will vary. So you can't get 100%, okay? It is not about 100%. It is about motivating yourself to do it. Just tick. And even if you're not scoring very high, keep on doing it because at least you're thinking about it and you're internalizing these habits. And once you internalize these habits, you find that this will become lifelong habits. Now, accountability, which is what we are saying, the groups have to be accountable to each other. It is responsible. Accountability means responsible behavior. Doing what you said you would do when you said you would do it. That is accountability. Sharing loudly, verbalizing to others is a powerful tool of accountability. So you go to your group and you say, this week, I did not do too well on my self-care, or this week, but I want to be held accountable next week for improving my scores on exercise. That is the one I'm going to target. You see? So you have verbalized. So you wake up in the morning and you're feeling too lazy to do your steps on the spot, but then you say, but see, I promise people, my group, that is accountability. And that is what the power of verbalizing. I want to cut down on my alcohol. I'm scoring too many on alcohol here. So I want to negative scores. So it helps you. Accountability partner can be a one person who helps you to keep your commitment, where you share and commit. Or it can be a group, and this is what we are saying. Let's have small groups of persons who meet online, whatever they want, on telephone, or, but group telephones are a bit more expensive than even WhatsApp group. It can even be a WhatsApp group. And they have common goals. And their common goals is to take care, self-care, is to track their habits in self-care. So what our participants' goals will be for this is that, self-care goals. After we do the psychological first aid, of course, the groups will also share experiences. How was your week? How did you feel? And even after the psychological first aid. But the core thing is to make sure self-care we are practicing self-care in our day-to-day lives, and we are sharing with others, we are supporting each other, we are giving tricks. Sometimes we have had in some groups that somebody will ask, how do you do it? And then you can say, this is the way I'm doing it, and it works for me. Of course, what works for me doesn't work for everybody else. And this is not the sort of group where one person knows it all, but it is a question where maybe you would like to try the way I do it, but it doesn't mean it will work for you. It is that kind of group which respects everybody. It is the kind of group where everybody has rights to speak. If nobody is wrong and nobody is stupid or foolish or lazy or anything, we are all in it together. It is not about winning, it is being part of the race and carrying each other, holding each other's hands. So this is what we are doing with the group. Groups will have a moderator and this person who brings the group together. Once we finish with our regular number of sessions, one of you can continue. You can continue as a group and say, we're finished with that project, but we are keeping it up, and we are going to alternate being moderators, because what moderator does is just to bring the group together, calls out members to remind them to speak, ensures that people keep time, because sometimes you can have a storyteller who takes all the time and everybody is there waiting and they can't stop. You have others who are very, very reserved, who need to be just encouraged to be said, would you like to say something? And then to ensure that the rules of accountability groups are adhered to, which I've just mentioned: respect everybody, nobody is wrong, nobody is the all-knowing, this kind of thing. So that's what an accountability group is. Now I'll summarize and then I can take any questions that you might have, either for anything we talked about. So our project is a telemedicine-based intervention to study to address the stress and trauma associated with COVID-19 among frontline health workers and support resilience through a group self-care program. The study will collect data to determine the levels of stress before and in the middle and after, to determine the effectiveness of this intervention. All data will be collected by trained research assistants on telephone or online or by self through a link, and participants will be assigned to small groups for weekly moderated sessions lasting about 45 minutes. Like I've said, you can also come with a group of your people and say, these are my frontline workers, as long as they are also frontline workers. The moderators are all trained psychosocial support providers. And this is the poster. I put the full poster here because this is, we have a big team. We try to involve people from all sorts of different areas. There's myself, there's Dr. Kanyanya, and I want to acknowledge them for all their effort. It's been, putting this together has taken quite a lot of time. Dr. Ian Kanyanya, he's in charge of mental health. Dr. Lydia Mainge is a psychologist from Kenyatta University College. Dr. David Bukusi, you know him, he's a mental health worker, psychiatrist from the youth clinic. Dr. Ann Boyle, Department of Psychiatry, clinical psychologist. Dr. Neema Araka is one of our registrars in psychiatry. She was really one of the key people in bringing this idea. What can we do for healthcare workers? So we have a lot of, she has a very big portion of this. Dr. Lincoln Kasakhala is a doctor, medical doctor, clinical psychologist as well, works a lot in the youth clinic, Department of Psychiatry. Matilda Mgoi is a clinical psychologist from the Department of Mental Health, Ministry of Health. Susan Ruturi, you know her if you're from Kenyatta. She's also a clinical psychologist from the Department of Mental Health. And I think she also works in the accident and emergency. Professor Ann Karani is from the School of Nursing and a professor in our College of Health Sciences. Professor Ann Obondo is a psychiatric social worker. She's also the head of the Department of Psychiatry. Dr. Teresia Mutavi is a psychiatric social worker, Department of Psychiatry. Dr. Maureen Nganga is a medical doctor from Kenyatta University Teaching and Referral Hospital. Dr. Kendi Laiboni as well. Dr. Catherine Getao is a psychiatrist, also from the Department of Psychiatry. Catherine Musioka, MS, is a clinical psychologist and a PhD student who's been working at the University Health Services. And we have Mrs. Judith Mugambi, who you know, who is the director, nursing officer. I maybe I've got the title wrong, forgive me. Kenyatta National Hospital. She's a director, nursing director. And she has been very, very supportive and has linked us to the nurse managers in the different departments. So we're going to be calling them. So when we call you, please, I hope you're here. I hope you understand what we're trying to do. We're trying to offer first and foremost support. And we have other partners. Of course, we have all the approvals from Kenyatta. We have approval from the research department, Kenyatta. We have approvals from ethics. We have approval from NACOSI. And we have other partners like the Division of Mental Health, represented here by Matilda Mgoi. We, of course, the University College of Health Sciences, Kenyatta National Hospital, KUTTRH, Kenya Psychiatric Association, Kenya Medical and Pharmacy and Dentist Union, and Center for Public Health and Development. These are all people who've been supporting us one way or the other, or who are willing to support us going ahead. So I acknowledge all those people now. If you're in this group and you're a frontline worker and you're interested to register to work in this project, be part of the project, I have put, I know there are so many numbers there, but we have our recruitment team. We have Dr. Teresia Mutavi, Dr. Ann Boyle, Susan Ruturi, Lydia Maingi, Catherine Getao, David Bukusi, Ian Kanyanya, and myself. You can call us at any time so that we link you to the data collection team. So I will leave those numbers there for the time being so that you have a time to copy them. And then I will, I'll be ready to answer any questions.
Thank you. Thank you, Professor. That was quite an informative session. I've learned a lot. I've actually jotted down a lot of things. We usually take our mental health for granted. And thank you very much for bringing awareness to this and for us to actually find avenues where we can seek out help. I think majority of us healthcare workers, we're very poor. We have very poor health seeking behaviors when it comes to seeking help in terms of mental health. So I will I will probably start the session by allowing a few of the people who've raised their hands for them to be able to speak. Abud.
I've stopped sharing so that I'll be able to. Is it possible to restart my video? It would be nice if I can see the people I'm talking to.
I believe you can. I believe you can.
I had tried it and it had said you cannot start your video because the host has stopped it. That's what I'm getting. Yeah.
Okay.
That's why I was talking to people without them seeing me. I'm sorry about that because I wasn't able to change that. Yeah.
Yeah, maybe Mwenda and Tim can address that because I think, yeah.
Okay, it's okay then. Well, I can start answering the questions. Let's hear them. If they can't see me.
So far there's no question on the question and answer, but there's a comment.
Yeah.
Websa Changer from Kilifi is noting this is excellent. Again, job. I'm a psychologist counselor in Kilifi County and was involved in doing PFA. And it was overwhelming to our healthcare workers since there is no guide principles in supporting self-care of workers, especially Ministry of Health. Health workers suffered.
Yeah, it's true that there has not been much structure in this, and of course, you have our number. You can take it down, and we can offer you support in Kilifi, even if you're not part of our site, not as part of the study, but as part of the work that we are actually doing. So.
Okay,
that
thank
is
you.
Just to the person. Yeah, just take my number or any of the numbers, and we can give you the support that you need.
Yeah, and then Professor, maybe of note, personally, a lot of coping mechanisms with healthcare workers is actually resorting to drug abuse. It could be in the form of alcohol. It could be in the form of sleeping pills or anesthetic drugs. And I don't even think, besides people using that, I think the biggest part that I find most challenging is the fact that we don't talk about these things. You would lose a colleague to drug and nobody wants to talk about it. Nobody wants to actually say, yes, I lost that colleague because of drug abuse. Or you see somebody doing that and we're all talking behind instead of, actually combining our efforts to help this person or this individual. How do we go about that?
First of all, like I said, our society holds that in very high place. We have a lot of responsibility, and that is also true. That we are afraid to look weak, but we are all human. We are more stressed than the other people, and we are human. And it's true, we lose a lot of even outside of COVID. We lose a lot of doctors, nurses, clinic officers to alcohol. And this has been something that I have seen even in our medical schools, that some starts in medical school, but people don't talk about it. Now, what can you do? The question is always, instead of talking about somebody behind their back, sometimes it helps to even say, I have noticed, like, maybe you could have a problem. Maybe you need to talk to somebody. There's something we call motivational interviewing, because of course, one of the things you meet is a lot of resistance, okay? A lot of resistance. So you don't want to like push it too much. You have to be very, very careful how you do it. And this is a mistake we sometimes make, and you feel so angry, like, oh, why is it? Why do you go into it like this, and you end up meeting a wall? So don't be surprised if that happens. So be very, very careful. But it is definitely good, or to look for somebody who is really close to that person, and says, look, I know you're closer to so and so than I am. Maybe you need to talk to them. I seem to think they have a problem, but you're right, we have to stop talking about it. We are not immune. In fact, we are vulnerable. We are not immune to drug abuse. We have easy access to sleeping pills. We have easy access to prescribing for ourselves. We all do it from time to time. So let's be very, very careful and let's talk about it. But that is why sometimes groups help as long as it is a safe space. Let's have safe spaces. We're saying that these groups must be, the rules of accountability, that space must be a safe space.
A safe space. So,
Must be a
Dr.
safe
maybe,
space. Yeah.
yeah, Professor, maybe in line of that, are there systems whereby somebody can easily report or raise a concern regarding a fellow healthcare worker who's probably abusing drugs or what have you, so that they can be able to be assisted efficiently?
I would be careful with the word report.
It's not report necessarily, but raise awareness.
Raise awareness. I don't know what the procedures of Kenyatta are. We definitely, as a university, we have our systems, you know, like you would first maybe talk to a chair of department and say, you know, I'm very concerned about so and so, and then they will do it. Or you would, like I say, go to somebody close. So I think I would like to leave that to somebody from Kenyatta National Hospital to tell us what systems they have in place. And you definitely have a staff clinic, you have a department of mental health, so maybe they're involved. But I must say, I don't know what you know, because the policies that we have at university, I follow university, the policies, and I'm sure there are other policies for Kenyatta National Hospitals. But definitely there is a need to be, because damages are done, and not just damages to self, but also to others through substance use. Abuse.
I'm aware. I'm aware that we have an employee assistance program that is based that usually has assistants, clinical psychologists who help staff who go through these things. So I have allowed a couple of people to speak. I don't know, Vince, Vespas Changer, can you be able to speak? You can unmute yourself. No. Yeah, so maybe Dr. another question that I probably had was regarding sleep. You mentioned something about our sleep. It's actually very disturbed because we have different shifts and what have you. What's the best advice you can give for somebody to tackle when it comes to having the best sleep with a shift system?
Okay. There's something called sleep hygiene. Of course, a lot of other type of workers have regular early to bed sleep during the dark hours, but this is not always possible with health providers, because some of them have night shifts and then the day becomes their sleep time. The thing is to make a regular sleep time must be the same, you know, within the limits of your working procedure, because there is definitely that time that you're supposed to be asleep. You need to have the time when you go to sleep and the time when you wake up. And try to keep to those. Some people say, what are the other tricks? There are several tricks, and we do all struggle a bit with sleep even for other reasons. What are the other tricks? One, you need a darkened room. And of course, we know that one of the problems you have when you are working at night and have to sleep during the day is noise and light. Try to darken your sleeping room. People say you can block your ears with, there are some earphones for noise, cutting noise.
Cancellation.
It helps. Yeah, don't use alcohol for sleep. There is evidence now, even night sleep, that alcohol actually, although it's a psychodepressant, it spoils your REM sleep and disturbs your sleep, so you don't feel better. Don't use sleeping pills, because sleeping pills, sedatives, they're benzodiazepines, they're addictive. And you're going to need more and more and more. and then you have problems like poor attention, poor concentration, accidents, and things like that. So you need to be very, very careful. Yeah, so it is not easy, but you have to do it within your time. That's why nobody should tell you this is the time you have to go to sleep, this is the time you have to wake up, because maybe the time you're being told to go to sleep is when you're working. Yeah? So you have to make your own program. And this may change from week to week. And I know that is very, very disturbing. But it is definitely, sleep is important. Good quality sleep is very important. Thank you for that question. That's a very good question because it bothers a lot of us.
So, Professor, another thing is about compassion fatigue.
Yeah.
You know, I remember when I was young and jubilant, you know, coming to work and starting and wanting to save everybody and everyone.
Yes, yes.
And you notice your energy levels are not the same with the rest of the people in the department, maybe because of their experience and what have you. So when does somebody know that they actually have compassion fatigue? Because most people are not even aware they have compassion fatigue. And what can you do to prevent to having it?
Well, compassion fatigue, what you need to prevent compassion fatigue is everybody needs a break from time to time, okay? So we all need those days of leave. And when you go on leave, you know, really, have that rest. We also need some time during the week when you have rest days. And we also need, that's what I said, one, you need to talk about it because it's a kind of psychological stress as well. Some people are more prone to compassion fatigue than others because of their personality. And there's some people who are like caring personalities who really can't let go. They take it home, you know? So talking about it helps. Sometimes people find writing about it helps. The other thing is, of course, the self-care habits, exercise, fresh air, all these things that boost you up. But sharing with others also helps. But we definitely have people who have a lot of problems because of their personalities. And personalities you can't change, but you can do something to mitigate the severity of that. And I hope that is kind of an answer. It's a complicated situation for health workers.
Yeah, it's usually very, very complicated. A lot of the people who are speaking, it's more of like comments. Thank you very much for a wonderful presentation.
Esther.
Yeah.
No, I'm just looking. Yeah, you can go through them because
Yeah, Esther is actually saying, I'm grateful for this. I have been having trouble sleeping and loss of appetite. What can it be?
Yeah, it can be a lot of things because I can't make a diagnosis on this, but loss of sleep and loss of appetite can also be signs of depression. And of course, that's not enough. We need more information. So you need to check other things like a loss of interest in things, loss of, things that made you happy before that you're not doing. Also the feeling of sadness, hopeless, despair. These can all be signs of depression. On the other hand, I don't even know your age, people are going through menopause. And I'm not saying, Esther, you're going through menopause. I'm just saying that that's why it's difficult to say, may experience problems with sleep and even with appetite. But usually it's just sleep. Appetite is not affected. So there could be other reasons for it. But I would advise you to link up and see. Is there another question?
Maybe the guys who've raised up their hands, I've allowed you to speak. I don't know why they're not unmuting. Abud Mubarak, Lorraine Muita, Vespas Chenja, Jacqueline Nyaga.
Okay, let me just speak now. Vespas is speaking.
Thank
Sorry.
you. Thank
Sorry,
you. Yes.
Sorry, as I was almost trying to speak, I was called by my medical superintendent.
It's okay. Go ahead.
Yeah,
Go ahead.
yeah. I work in Mariakani Sub-County District Hospital. I'm a psychologist, as I've just said.
Mhm.
And I want to thank you, Professor, for putting this one in light. My thought is, after perhaps you do that one in Nairobi, more so Kenyatta, you should also perhaps think of remembering other counties, because our health workers, sincerely speaking, they are really troubled, and especially to talk about, you realize that nurses, they do psychology now, they think up to somewhere first year, so that they drop it. Other cadres the same. You realize that very many people who are working mostly in the Ministry of Health, always most of quite a time they undergo what you call compassion. I mean compassion or fatigue, or compassion or fatigue, to say so. I realize that they don't have a mechanism to be able to listen what they are going through. Adding up the issues concerning the burnout and the Ministry of Health, even as now, when we had this new pandemic, very many people are left hanging with the issues concerning economy, the issues concerning how to raise their kids. So at the moment, some counties have already gone to strike, but people will be coming back to work. As they become back to work, they are still bottling up with these stresses and depression, which has not been dealt with. So as you do that, maybe trickle it back to other counties so that we can be able to work together.
Thank you, Vespas. You are here, you are the representative of the other counties, so you can reach out, because we are going to start, but we also start training people in other counties to do the same thing and to try it out for themselves. So we are quite open to that. So if you reach out, you will be the first one from the other county and to say, yes, we want to do something. We want to support each other in this profession. So thank you very much. That was a good suggestion. So I think my email address is somewhere there, or you just telephone number to any of those numbers, and we can see what we can do for you.
I will.
Yeah.
Thank you.
Okay. Thank you very much.
Thank you, Vespas. Maybe George wants to speak. George Omondi. Okay, but maybe just to add, there's we are trying to build capacity under UHC and medical outreach in terms of mentorship and capacity building. So, Professor, it's good you're aware that that's in existence. We do it with the counties, so we can always have a more systematic approach in terms of making sure we have the mentorship capacity in the counties more efficient and effective. Yeah,
that's great. That's great.
Yeah, I don't think a lot of people have a lot of questions. Most of them seems to be more of comments than questions and suggestions. And thank you very much. We are all listening to this.
Can I make a comment on one of the comments? Somebody talked about, if you excuse me, there was one comment about our society teaches us and socializes not to talk about our issues, and we are taught to think about as a sign of weakness. Yes, that is true. Societies do tell you, particularly if you have thought of us in sort of, your health, you have people who are giving the answers, you are teaching communities on. But we do know that it is not a weakness to talk about your emotions, your feelings. And I know, but the person who asked that is a woman, and it's usually very hard on men, particularly, to talk about their feelings, their weaknesses, and things like that because of the social socialization and the thing. But we need to change that, and that's why I say you need a safe space, and we need to be the people who respect that safe space among ourselves, so that I can talk about my feelings, how devastated I was that when this person died, or when they did what, or I felt guilty, and know that it will remain within that safe space. So I think it's something we need to cultivate more, talking about our feelings and sharing within the safe spaces, or finding that one or two people who you trust, who you're accountable. I said there is also something like an accountability partner, or something you call a buddy. You know, it can be a, you know, somebody you can share with without feeling judged. Thank you. I just wanted to comment on that comment. Thank you. It was a nice comment, very good comment. Rose. Yeah.
A very powerful comment. There's one that I missed. I used to have a healthy 8-hour uninterrupted sleep routine that I'm struggling to get back post internship. I can barely sleep for 2 hours straight. My appetite is not what it used to be. I'm assuming it's low. And basically, I've learned a lot today. Thank you. I hope it will help.
Yeah. I hope you'll be able to read up sleep hygiene. It's the sleep hygiene really helps. Yeah. And avoid, of course, the stimulants. I'm a coffee drinker, but I stopped drinking my coffee at around 1 o'clock, and I stopped drinking tea at night. And so in the evening hours towards night, people take tea and expect to sleep, but tea is a stimulant. So avoid stimulants, fresh exercise, don't. And then there's something just by the way, you need to read up, that's for this person, you need to read up something called blue light, which is coming from the gadgets, and how it affects sleep.
Okay.
But that's a whole new thing. That's a whole new topic on sleep and the kind of skills. Yeah.
Sorry, Professor, maybe you can answer a question that I had. There's this, you know, I remember the first time you were speaking about the vaccine, that we need to get proper information and what have you, and everything of that sort. I remember I had this question for Professor Walter.
Yeah.
How would you advise on the social media? Like, we get a lot of content that is anti-vaccine in a very funny way, and we like sharing it because, I mean, it's funny. So we keep sharing it, and it actually has an impact, I believe, in how we think, how we absorb this data. How do you think we can tackle such issues?
I'm well known for getting angry when health workers spread those
false information.
Information. And I cannot resist saying, please don't do that. Don't do that, because we are misguiding people by spreading it. You think it's a joke? It's not a joke. You know, when you start spreading pictures of Bill Gates with the flashing eyes, you know, it's not a joke, because people are seeing it and they're actually believing, you know. People are seeing and they're actually believing that the West wants to eliminate Africans with the vaccine. I mean, we should be at the forefront of fighting against that. So there are certain rules about this. If you read something, first check it out for
verifying
truth. Is it correct? And use valid sites, you know. Check it out. And by the way, some of these stories, there are some websites right now which can tell you almost immediately whether it is fake, whether it was manufactured in somebody's laptop, or not, So I think it's really important that we stop spreading, and if it happens, be the one to say, this is not true, or this has no scientific basis. Some of those things are ridiculous, you know, they have no scientific basis. And it's sad, because some people will refuse to get vaccinated in this country. And I'd be sad if health workers will be among them, to be really sad.
Yeah, and then Professor, to top it up, for me, I always say, as a healthcare worker, if I post something like that, the effect it has on somebody who's not a healthcare worker, I'm coming from a point of knowledge. So somebody would actually believe what I'm posting more likely than somebody who's not. So I think it's good when we have that social ethical responsibility on social media platforms.
Yes.
Yeah.
Thank you. Thank you. That was really a good comment that you're making there. It's really
Yeah.
valid one. Yeah.
Yeah.
Excellent.
So maybe to sum up the things that we have learned today is sleep is very important. We need to have enough time to sleep. Our nutrition is very important. We need to eat the correct things. Don't take it for granted. We need to exercise for 30 minutes a day. And I think exercise, Professor, if I'm not wrong, I was being told you have to be doing something for more than 30 minutes. Your heart rate has to be more than normal for 30 minutes. It's not just walking alone. it has to be, you know, something engaging that makes you sweat.
Yes, it is active exercise. I would not cross the lines of cardiologists, but it's active exercise. That means even if you're doing it in your room, it is up and down. But try, you know, most people's have phones that can also track their steps and their walking, and you know. So
then for me, my other take-home message was to have a gratitude journal, to always remember what we need to be grateful for, and to also have a worrying journal whereby we write down what we are worrying about and we see how we can go about it. Because when you talk about it, there was this something somebody always says: if you hold a glass for 5 minutes and then 1 hour and then 2 hours, they're not the same, because one, you hold one thing over a long period of time. So that similitude that I always found to be very nice, in terms of don't hold on to something for too long. It becomes bigger than it was initially. So I think those are the main things I got from this session. Thank you very much, Professor. Unless I missed out something, together with the contacts you've given us, I think this session will be uploaded on our webinar platforms. For the many questions regarding CPD, I believe for the doctors and the pharmacists, it's being taken care of. For the clinical officers, we're in talk with the body that usually gives you the CPD points. I hope we'll be able to give it soon. For the nursing, we're also doing the same. However, if you want to pick it up, I believe you can get the points from our research department. Thank you very much, Professor, for your very delightful talk.
Thank you very much for giving me this opportunity, and I hope we will be able to support as many as those who are interested. Thank you. Thank you very much.
Thank you too. Have a lovely day. So I believe today this will be the end of our session today.
Bye. Bye.
Bye. So sorry, for the next talk, you can see will be on Wednesday, Overview of Ovarian Cancer by Dr. Mukomba. So we'll see you again on Wednesday. No session for tomorrow. Thank you. Bye.
Thank you. Bye.